Good afternoon, everyone. Thanks for joining us today for today's webinar. I'm Dolores Woods, Nutritionist Supervisor for the Nourish program at the Michael and Susan Dell Center for Healthy Living at UT Health Houston School of Public Health. As a chef and registered dietitian, I'm passionate about teaching others how to cook healthy food, how to grow their own food, and achieve a healthier lifestyle. Today's webinar is hosted by the Michael and Susan Dell Center for Healthy Living. The center's vision is healthy children in a healthy world, with a mission to advance health and healthy living for children and families through cutting-edge research, innovative community-based programs, and dissemination of evidence-based practices. Information about the center's work and resources can be found online. Please scan the QR code on the screen to access our health resources. The slides and recordings of today's webinar will be archived on our website, and if you have any questions during the presentation, please enter them into the question chat box for a Q&A session at the end of the presentation. Without further ado, I'm excited to introduce our speaker today, Emma Saving. Emma is a Master of Public Health student working in implementation science research at UT Health Houston Center for Health Promotion and Prevention Research. Emma's completing her practicum with the Nourish program at the Michael and Susan Dell Center for Healthy Living and the Nourish program's Holistic Garden, with a focus on community health promotion through community gardens and farms. I will now hand it over to Emma to start her presentation about growing healthier communities, exploring the health impacts of community gardens.
All right, thank you so much for that lovely introduction, Dolores. Hello, everyone. I want to introduce myself. My name is Emma Saving, and today I'm going to be speaking with all of you about growing healthier communities, exploring the health impacts of community gardens. So let's get to it. All right, so the agenda for today, this presentation is going to be in two different parts. First, we're going to get into a review of the current research. So what does current research and scientific literature tell us about the links between gardening and health? And we're going to come at that from kind of two different angles. From the medical side, so how does gardening and gardens help patients? And then from the community side, so how does gardening affect communities and community health? And then we're going to get to some more original work. So we're going to be talking about the gardens and gardening scene in Houston. So I went out and I interviewed different people from different urban gardening and farming organizations, as well as research organizations in the Houston and Texas area. And I'm going to share with you some things I've found about how these organizations affect human health and how they affect health equity. Okay, a bit about me. You've already heard kind of an introduction, but I got my bachelor's from Rice University in biology, and then I started working at UT Health in implementation science, which is basically just evaluating and planning health interventions for their effectiveness. And I'm now getting my master's in health services at UT Health, and I'm doing my internship and practicum requirement with the Nourish program and Holistic Garden this summer. That photo is me in the UT Health Holistic Garden with, I think, some basil and kale. But yeah, so that's a bit about me. So why is this topic important? Why should you care about the links between gardening and farming and human health? And I've got 5 kind of general reasons that we're going to dive into here. So first, and the most obvious, is nutrition. It can be difficult in an urban setting to always have access to healthy foods, fruits and vegetables, and difficult to just know, where does my food come from? So we've got the nutrition aspect of gardening, which is really important. Then we've got actual health benefits, for physical and mental health. So there's a lot of research out there proving that gardening has great effects on both your physical health and well-being and your mental health, psychological health. We've also got the dimensions of social health, and that's kind of related to the next point of community bonds. So community gardens can be just kind of a hub of activity, kind of a lifeblood area of the community where people are able to interact, to really build something beautiful together and nurture these plants, as well as nurturing their social and community bonds. And then we've got kind of the last point to sum it all up, which is connecting with nature and communities. Again, a lot of times people who live in urban environments today have kind of this disconnect from nature. And urban gardens, urban farms, these can really be a way to reconnect with both nature and your community. Okay, so now we're going to get into the research side, and I'm going to give you all kind of a background on what I found from looking into scientific research on gardening and health for both patients and communities. Okay, so to start with, we've got health benefits for physical and mental health. Lifestyle diseases are on the rise. You might be wondering, what is a lifestyle disease? It can be anything from heart disease to diabetes to even different kinds of cancers, where your lifestyle and the choices you make in your lifestyle, it doesn't necessarily completely cause this disease, but it can really contribute and worsen the effects of these diseases. And lifestyle diseases also just tend to happen more as people age. We've got an aging population right now in America. And lifestyle diseases are just really on the rise. A lot of the cause of that is because people have sedentary lifestyles. A lot of jobs today, a lot of work kind of needs to be done just sitting at the desk. People don't necessarily have as many opportunities to sort of move around, walk around, and that's been worsened even by the pandemic in recent years. So sedentary lifestyles are something that we really want to try and combat. That and just having a lack of nutritious food. So gardening can be a really great choice for impacting your physical activity. There is a certain amount of physical activity that everyone is supposed to get in a week. You're supposed to get a good amount of moderate and kind of more intense physical activity just in order to meet kind of guidelines for health. And that can be a challenge in today's world. Gardening is a great choice because it's a very low impact physical activity. It's family friendly. If you're elderly, if you have young children, everyone can get involved in gardening. It's not as strenuous as something like going for a run. And it's a great way to just get outside, get a little bit physically active, as well as having this dual purpose of being exposed to nature. I put nature prescription actually down on this slide because there's a new kind of phenomenon happening in some hospitals where doctors are starting to be able to prescribe nature to patients. Time for them to get out into nature as a way to improve their health outcomes. And these links to getting out in nature, physical activity, and social activity are so important to kind of holistically improve patient health. And we've also got research that shows improvements for people who go through gardening interventions in physical health, in cognition, mental health, reduced stress, and reduced hospitalizations. And that last one, reduced hospitalizations, is actually research showing that if you live in an area that has more access to green spaces, nature, tree cover, you're, I think it's 30% less likely to be hospitalized due to obesity or other lifestyle disease related conditions. Okay, and next we have improving the care environment. So now we're going to kind of get into what do some of these interventions actually look like. So the first one, we have hospital healing gardens. This is a place meant for both patients and visitors. And it's when a hospital or possibly like a care home that has patients living there will install a garden or a couple of gardens. And that's meant to be a space, both of rehabilitation for patients and for just visitors, people to enjoy, walk around, again, get some time in nature. So somewhere that already has a nice established hospital healing garden is Baylor Scott & White, again in Texas. They've recently put in a healing garden. And then Houston Methodist is actually doing some really exciting work they're going to be building a healing garden on the top of one of their new towers. In this healing garden, they're going to plan garden interventions. So that might take the form of, say, classes in the garden, or potentially like health interventions that just take place while you're in the garden, kind of among that little pocket of nature. They're also going to be giving patients who have low mobility and just kind of severe conditions rooms that actually overlook the garden. So there's some research that shows that even having the smell and the sight of nature can still improve your mood, improve cognition, and reduce your levels of stress. And that's where virtual reality gardens are going to come into play as well. Houston Methodist, again, is going to be testing virtual reality gardens and seeing if patients spending time in virtual reality with these virtual gardens, if they also have these same kind of health benefits. And when might a virtual reality garden be better than a regular physical garden? Well, that's when you have a patient that might have like a high fall risk, low mobility, or just someone who's really not able to leave their bed at the moment. The example I was given was dementia patients. This intervention could be really good for dementia patients who they might have kind of a high fall risk and might have kind of confusion and wondering if they're kind of just in this garden space. So yeah, we've got hospital healing gardens and just natural landscaping and gardens in the medical center. It's really nice to just have this little view, these little pockets of nature when you're a patient or when you are in the medical center to go see a patient, a loved one. And then another kind of intervention that we have related to patients is hospital garden kitchens, and then teaching and demonstration gardens. So actually here at UT Health with our Nourish program and holistic garden, that's a great example of a teaching and demonstration garden. That's where we have our own garden growing all kinds of vegetables and things that are in season. And we have this amazing kitchen setup that's really large, and it's meant for hosting workshops. So we'll have groups come in, such as like internal medicine residents come in, do a workshop, go and harvest some of their own vegetables or fruits, and then come in and we teach them how to prepare a healthy meal. So some healthy recipes with these vegetables that are in season. It's really important to kind of have that teaching factor, because even if you're able to grow and get access to these amazing fresh fruits and vegetables, if you don't know how to prepare them, then that could end up just being kind of a waste. And then hospital garden kitchens is also kind of a new kind of intervention that's happening. There's a hospital that's put one in, and that is where a hospital does have a garden, but it's dedicated specifically for food and herbs, or even possibly medicinal plants that are meant to be used by the hospital for patients, or even to cook like staff meals. And this is kind of a new sort of idea, but it's already showing some great signs of success, uplifted mood, and just health benefits that are happening in these hospitals with these new types of interventions. Okay, and then getting into some of the literature on gardens for communities. A couple of themes I've pulled out here are health and nutrition, and just again, this strong sense of community and social bonds. So community gardens can be and are described often as part of the integral fabric of a community, a place where everyone can come together and make something beautiful and healthy, healthful, just for the whole community. And it can be characterized as a health intervention, but most people aren't thinking in these very medicalized terms. They're thinking of gardens as more than that, as this social and nutritional hub. There's research showing that your physical health, mental health, and social health improve greatly when you participate in community gardening, whether that's just kind of on kind of unscheduled, irregular times or through scheduled actual classes. And there's also the factors of climate resilience. So if you live in Houston, you know we have all kinds of natural disasters. Sometimes you're not able to get food from like the local grocery store. So community gardens are a great way where you can have some food that's grown locally, that you can be able to kind of get that and have that local source, even if you're not necessarily able to access other sources due to just factors beyond your control, such as a natural disaster. And there's also community food events. I think lately I've seen like at least 2 different salsa making competitions at different like urban agriculture organizations. But having community food events, places have like volunteer days, special workshop and education days, or just sort of like a food festival, maybe like a pick all the tomatoes day as they're going out of season. But community food events are also a really, really beneficial thing that can happen with community gardens. And then we've also got this point where marginalized people can benefit most. So I saw multiple times that people who come from a low income background, people who have food insecurity issues, really, really reap the benefits of community gardens. And as well, we've got women and elderly people who also have like kind of stronger amplified effects, positive effects on their health and mental health from participating in community gardens. And we've also got immigrants and refugees. And we're going to get into this a bit more later, but community gardening can be a great place to kind of bring in some skills that you might have from your home, maybe grow some vegetables that you're more familiar with from kind of your home place, and really just get kind of integrated into the fabric of the community. And then we've also got kind of the legacies of segregation and redlining. In some communities that were like historically segregated and redlined, there is actually a lot less nature, a lot less tree cover, and less space for things like community gardens. So in communities where these are being able to be built, people really reap amazing benefits from being able to just transform their community and have this kind of beautiful and productive piece of nature. And then I've touched on this already, but we've got food security increases. Now, a community garden is not going to solve hunger for the entire community, but there are proven to be positive effects on increasing people's food security, increasing their access to fruits and vegetables, and where there are cooking interventions, increasing people's knowledge and confidence in being able to prepare and cook healthy foods. Okay, so now we're all caught up on the literature, and we're going to get into my research. So here are some of my observations on urban gardening and farming and human health right here in Houston. So here are all the organizations that are kind of the people that I spoke to are parts of these different organizations. I was able to meet with and interview 7 different people, and the ones that are in kind of a larger font are where these people work with and are affiliated now. And then the kind of smaller font is where some people had some past and previous experience, because I spoke to a lot of people who are well into their careers, have many, many years in different organizations experience in community gardening, urban agriculture, and also research on health and nature and agriculture. So we've got some research institutions in here. Yeah, so kind of a great diversity of different organizations. And then here were the questions that I asked everyone. Now, it's not an exhaustive list because I did kind of tailor each interview to different organizations. So if I was speaking to a researcher who works mostly on the impact of nature on communities, I asked a little bit different questions than if I was talking to someone who was a farmer and that is their career and they're really a lot more knowledgeable about maybe the food security and just eyes on the ground, seeing what's happening in communities. But these 3 questions are what I asked everyone I spoke to. So just a nice general question: how do you describe your work and its relationship to health? And then in what ways does the issue of equity inform your work? This was a concept that came up again and again in the literature. Community gardens, just in a nutshell, are super effective and a great intervention in places that are kind of like low income. And it's really a really nice way to kind of increase health equity. And then I asked, how do you see health, nutrition, food, again, tailoring this a little bit to each individual person, but how do you see the health, nutrition, and/or food security effects in the community from this work? So how does your community interact with your work? What do you see? Okay, and I've made a couple of diagrams. I had a ton of different themes come up, but I'm going to focus on kind of 4 different sort of themes. And I'll have an appendix at the end if anyone is interested in learning more. But the first one, and the most kind of, I guess, negative in tone, is barriers to positive health outcomes. So I'm going to kind of try and go in sort of a clockwise manner to talk about this. So we're going to start in the middle. When you have low resource areas, and why might people live there? People in low resource areas usually have kind of a lower income. Again, we've got the legacies of redlining and sort of the urban planning effects of that. And low resource areas, again, have this lack of green space and lack of tree cover, which leads to less space and less opportunity to do outdoor physical activity, connect with nature, which leads to poor health outcomes. And then additionally, if you have a lack of green space, then you have a lack of land area to build things like community gardens or community farms. And that can, again, contribute to outcomes such as a food desert. There are a couple different terms for this, but basically what I mean by a food desert is a place where there are quite a lot of barriers to accessing healthy, nutritious, fresh food, especially like fruits and vegetables. And kind of a common misconception, I guess, is that there might be a food desert where there simply aren't enough grocery stores. That definitely can be the case, but it's not just a lack of stores. It can be a lack of transportation. Maybe walking isn't safe. If you live in Houston, you know our sidewalks are very uneven and sometimes non-existent. And you have, of course, traffic concerns if you have to cross busy streets. And it can also be just a lack of these stores being able to function in events such as natural disasters or hurricanes or tropical storms. So again, when I say food desert, what I mean is a place where there are a lot of barriers to sort of accessing fresh and nutritious food. And again, if you're in one of these areas and you have like $20 to spend on your grocery budget that week, and you can spend $5 either on some prepackaged foods that are, you know, not exactly healthy, but they have quite a lot of calories kind of like per bite of that food, or you can spend that on a few vegetables to kind of make a salad, which is very healthy, has great nutrients, but might not have a lot of calories. You're going to have to prioritize calories per dollar. You're going to have to use your money in that way just so that you can get enough food to be able to survive. And nutrition is not necessarily going to be what you're able to put a high priority on. And then again, that can lead to poor nutrition outcomes. It can lead to obesity outcomes and just generally poor health outcomes. So yeah, these were a lot of the themes I was seeing from different places around Houston, different neighborhoods. And community gardens are something that can help with this. It's not going to 100% alleviate the negative health outcomes, but it is a way to help and a way to kind of make progress. Okay, and now on to a few kind of more positive topics. This was an interesting theme, the importance of passing down knowledge. So if you see kind of to the right side of this diagram, a bit lower down, I have that farming is a shrinking field. And this is something that I heard several times from people that I was interviewing, is that a lot of people are kind of exiting the field as we get more technological advancements with machines and things like that. You don't necessarily need as many people. A lot of these processes are sort of automated, done by machines when they used to be done by hand, by people. So a lot of people are actually leaving the field of agriculture. And how do you maintain an agricultural workforce and support them when it's something that's so important that everyone needs agriculture, everyone uses these grown foods every single day? And something interesting that I found actually a few times is that women in the agricultural workforce are kind of growing in visibility, kind of gaining confidence and more sort of recognition for their efforts. Historically, the field of agriculture has been pretty male dominated, but we have that women are really some key knowledge holders. A lot of women historically like kept the books for their farm, did a lot of the organization and just a lot of the labor for farming. And we have amazing things now like organizations that specifically support women in farming, conferences, and just kind of lifting each other up and empowering women as kind of a key knowledge holder and part of the agricultural workforce. We've also got medicinal plant knowledge. This is something I wasn't expecting to run into just because I didn't really grow up using medicinal plants. But if you head down to like the Herman Park, Centennial Gardens, there's an amazing area with medicinal plants. There are plants that can cure like a toothache, that can help with fevers, all kinds of different ailments. And that is actually a type of knowledge that's kind of disappearing generationally. I was looking at some different studies from South America and from, I believe it was Japan, where different universities are kind of establishing gardens specifically for medicinal plants for use by the community as well as medical and health students. And the findings are that this knowledge of medicinal plants has really been decreasing across generations. So that is, again, another key pieces of that, medicinal plant knowledge is another kind of key piece that we definitely want to preserve and keep passing down to the different generations. And then we've got just growing food. There are all kinds of exciting new agricultural techniques. There's a lot going on in urban agriculture and in finding how do you make kind of a small space very productive and very just vibrant. And we've got growing food that's native both to the area and also native to different people's homes, like home country or home state. If you've moved a great distance, like in Houston, we've got gosh, I think okra's in season right now, some great Southern cooking. And I've also been to a farm where they had a lot of like African farmers, and I got to see cassava plants like for the first time. So it's really important to have food that's both native to the area and also for people to bring the foods with them that they're familiar with. Houston's a great place for this. A lot of different types of foods really are able to thrive here. So you can kind of conceive of gardens as this kind of cultural center because food is a key part of culture. And then kind of connected to that again, we've got preserving heritage. Food is a huge part of heritage. It's a huge part of where you come from, what you cook. And gardens are a really great way to kind of preserve some aspects of that. We've also got preparing healthy foods. So again, people need to learn how to cook healthy foods and also how to preserve foods. So that's like pickling, canning. My own mom actually took up canning a few years ago, and I just think that that's really great. You're able to have this resource when you might not necessarily be able to run out to the grocery store and grab some fresh fruit. But these pieces of, and again, a lot of the cooking and preserving knowledge, I really should have looped that in with women because that has been knowledge that a lot of women have kind of kept up that knowledge, kind of passing it down through generations. But yeah, that's another really important aspect of knowing how to prepare and store and preserve healthy foods. Yeah, passing down knowledge, super important. And then we've also got supporting farmers. I'm sure you can imagine this was a huge theme for most of the people that I was speaking to. And we're just going to go kind of clockwise around. So starting with agricultural education, a lot of people come into the field with some skills, either from their home if they've moved to this new place and are starting farming, or possibly it's been passed down through their family. But there are also newcomers to this field. So how do we get people education in agriculture? There's a lot of science behind it, behind soil, behind how to best use the land for productivity, how to have sustainable practices with the land. So it's really important for farmers and prospective farmers to be able to get that education. piece. And a lot of times the funding for this is actually done through grants. If you just Google like garden grants near me, you're going to find several. So a lot of this, again, agricultural education is done through grant funding and scholarships. And there can even be funding for apprenticeships. So there's a program in Houston where that's going to start soon, where people will be able to work as an apprentice for a year on a farm, get connected with other farms, and then at that point, they'll have the skills to be able to become just a farmer in their own right. Yeah, so this agricultural education piece is super, super important. And also the funding piece is important. And that can be kind of difficult. There isn't necessarily a lot of high wages going on in the agricultural field. Another theme I was seeing a lot. But there can be like enough to live on, enough to live a good life. And you might just need to be able to consult kind of these grants and scholarship funds. And again, going with the money theme, we've got affordable land tenure. So this was kind of an interesting one. But if you are renting land, say from the city or from somebody, and they suddenly decide they want to redevelop it, maybe build a shopping mall, build some apartments, what recourse do you have? You are going to need to relocate your farm, and that's very difficult. It takes a lot of work to relocate or to just abandon the garden and replant elsewhere. Additionally, as far as affordable land, we've got kind of like packed urban communities where there might just not be a lot of space to put in something like a community garden. There might not be a lot of necessarily abandoned lots. You might have to just use the space you have available. I know there are some really cool rooftop gardens going on just throughout the Houston area where people are just able to use this space that you wouldn't necessarily expect to have, again, this urban garden. So yeah, land is a big concern. And that also comes in when people are moving, again, when people are possibly like immigrating or maybe are refugees. How do you find access to land to either own it or to rent it to be able to do farming? Yeah, so affordable land tenure is a really important part of supporting farmers. And then of course, we've got providing a place to sell food. And you can do this in a lot of different ways. We've got farm stands or farm stores. And this, you've probably driven past one at some point in your life, but it's when a stand is set up kind of near, like on the property of a farm or a garden. And that is where the farmer will be selling kind of some of the fresh produce of the day. And you're able to kind of go and pick that up. There are a lot of places that have this around Houston. And we've also got farmers markets. Again, several of those happening around Houston. But these markets partner with farmers. It can actually be kind of difficult to get like a booth at a farmers market. I looked into it. But farmers markets that partner with local gardeners and local farmers, and they'll have a booth, be able to sell their produce. And then we've also got other community partners. So this might be like a food bank. If you have some extra produce that you've harvested at the end of the day, it's fresh, it needs to be used. A lot of places partner with like the Houston Food Bank and are able to donate some excess produce, which is really amazing. Food banks tend to have a shortage of these fresh foods being donated. And other community partners, that can include, I've got another arrow over here for community visibility and linkages. A lot of gardens are actually a part of a school, maybe a church, maybe a community center. So these are just kind of, again, community hubs where people can kind of go for a multitude of different purposes and still participate in community gardening. But again, partnerships are so important. It can benefit everyone involved. And then we've also got farm share boxes for selling food. Now, there's a couple of different models that you can use with this that I heard about. One is selling, sorry, let me just explain really quickly, what is a farm share box? So it's kind of a subscription. Farmers will pack whatever is kind of the fresh produce of that week, a couple different types of vegetables, fruits, and maybe like 4 or 5, and then pack them up in boxes and distribute them. And there are farms that do this for free or for extremely cheap to the community, where the purpose is mostly let's help alleviate some food insecurity and nutritional deficiencies in the community. And there are also, excuse me, and there are also farms that sell these at a little bit of a higher price point. And that is just to get profit to a lot of the farmers and really support farmers. And people who buy these boxes can, realize that they're, helping support local agriculture and getting extremely fresh food. So lots of benefits kind of all around from farm shares. And then we've got just empowering growers. That's kind of what this whole web is about. How are people currently empowering and supporting farmers in the agricultural field? So that we can continue to pass this knowledge along, have these farming and gardening hubs, and be able to get people's produce distributed to the community. And then finally, we've got supporting the wider community. So again, in the middle, I have supporting communities. How does urban agriculture support communities? And we've got, again, going roughly clockwise, we've got agricultural and cooking education. Again, with a lot of these farms or gardens, some of them have a teaching component, a teaching kitchen, or maybe cooking workshops. And a lot of them also have agricultural education. There are places where you can sign up and it'll be kind of learn to be a farmer for a day types of programs, and volunteering as well, where you can gain some agricultural education. And a lot of places also do cooking education, recipes as well for these very healthy and fresh foods. We've also got adding green space to the neighborhood. Everyone wants to live in a beautiful neighborhood with spaces for nature, space for things like community gardens. And we've got reclaiming unused land. If you have just a lot that's been unused for a long time and you're able to develop that into a community farm or garden, that can be just a really amazing kind of bright spot where there used to be just not a lot going on that lot. We've also got having a place to obtain free or cheap healthy food. So again, in some urban communities, it's not necessarily easy to just go to the grocery store, buy a bunch of fresh food, and you've got all of your nutrients met. And community gardens can be a great place to obtain free or cheap healthy food. Again, with our farm stands or farm stores, farmers market, different community events. I actually heard about one kind of recent community event that took place right after the kind of May storm, so not Beryl, the one before that. And the group, it was meant to be a fundraising event, but the farm actually ended up giving away tons of free food to people because a lot of the roads kind of weren't safe and grocery stores were kind of inaccessible that weekend because of the terrible storm. So again, we've got community events, and that is where the focus is really to support and engage the community. I heard this from a lot of people. It really matters why you're doing what you're doing. And a lot of people go into urban agriculture because they want to support the community. They want everyone to be able to have the opportunity to have really great nutrition, healthy, fresh, and local food. And community events are just a great way to have that connection, again, with the community. And then we've got farm share boxes. I was speaking with someone from an organization that does free farm share boxes and partners with kind of local orgs to do that. And they actually have seen from surveying concrete health improvements. So more food security, more confidence in being able to cook with these healthy foods. People report concrete health improvements from these initiatives. And then of course we've got our culturally and locally relevant foods. Touched on that a few times, but again, really important to kind of have food is like a cultural touchstone, and it's really great to be able to grow that in your own neighborhood. And just empowering communities, having family-friendly community activity. Gardens, again, are a great place for that. Children, elderly people, anyone can participate in community gardening and in these activities. Okay, and I want to just have a couple of kind of main takeaway points for you guys. One, nature is healing. That sounds a little bit cheesy, but it's true. Getting out there into nature, getting involved with community gardening, community farming, it really does provide healing physical effects. And then we've got community-based work. So community really is the key. A lot of people get into this work because they want to support their local communities, and have the garden again as this kind of social hub and a place where everyone can kind of come, get involved in nature, get involved in growing, and also again benefit from just having healthy local produce. So community-based work is key. And I also really want to encourage everyone to get involved locally. There are probably community gardens or community farms near you. It's super easy to get involved. I didn't know much about this at all before I started this practicum this summer, but there are a ton of different things going on in Houston and probably in whatever place you live in as well. It's easy to get involved locally, and it's just very rewarding work. Okay, and then this is kind of a list of some other themes that I found a lot. These interviews were honestly like a gold mine, and I learned so much, but these appendices are again going to be on the Dell Center website with these slides if anyone is interested in checking out kind of more of these themes that I found from community research. References, again, for some of the research I cited. I'm including my email as well. If you have any, I think we're about to get to the questions section of this webinar, but if you have any questions that aren't answered, or you just want to chat about some of this work with community gardening and agriculture, please feel free to contact me. Here's my email. And I would love to chat with anyone who has more questions or more thoughts on this. I want to really thank UT Health Houston, School of Public Health, and the Dell Center Nourish program for giving me the opportunity to speak about this. Okay, and I think Dolores can take it away here.
All right. Thank you, Emma. That was great. A lot of information. So we will now take some time for questions. There are some that came through. If you have more questions, please type them into the question chat box. So there were some questions about the hospital setting. If you came across information on who maintains those gardens in a hospital setting.
Yeah, that is a really great question. So a lot of the community gardens that are maintained, so non-hospital gardens, are maintained by a combination of staff and volunteers. But for some of the gardening initiatives that are happening like in hospitals, I believe it tends to be mostly staff that are maintaining these gardens. Although I think that there are opportunities for volunteering, but this is kind of a newer sort of area. I believe for the Baylor Scott and White Healing Garden, I believe that that garden was kind of designed with proposals like by university students, but I believe it is staff that usually maintain these hospital gardens.
Okay, great. And did you come across any resources or community gardens in San Antonio? It's like we have someone in San Antonio.
Okay, welcome to anyone who's from San Antonio. I did not look into San Antonio for this. I know that San Antonio has like a branch of the UT Health School of Public Health, so it's possible that there could be some connections there. But I really was focusing on kind of the Houston area, and then I guess this one kind of Dallas area hospital, but I really was kind of focused on the Houston area. But if you're interested in connecting with resources, you can do a little bit of kind of searching on the internet. I'm sure San Antonio is a huge city. There are going to be urban gardening and urban agriculture resources. Not sure about any hospital gardening interventions, But yeah, I was really kind of focusing on the Houston area. But good luck, and I hope that you're able to find something.
Yeah, and I think the Texas Children's Nature Network is out of San Antonio. They may have some resources for gardening. Okay, so next question. Do you know about any school or communities, particularly vocational high schools, implementing community gardens?
That's a really great question. The people I talked to who worked in schools actually worked in elementary schools, so I didn't really get to hear about high school gardens or specifically vocational high school gardens. I did get to hear some great stuff about people coming in weekly to educate like elementary school children, where they have a farm that's kind of on the property of the elementary school. But I'm not really sure about high schools. That is a really great question, and I would love to hear more about that.
I will share that Houston ISD actually has a food and agriculture literacy center. It's a farm, it's the Macawa farm, and their students go in there. It's a working educational farm, and they integrate nutrition, food science with the core curriculum. So that's a great resource if you're interested in learning about that. That could be a good starting point. One of our graduates from the dietetic internship here is actually leading it, so that's how I know. But good question. And so, also, what are your thoughts on adding one more beneficial component to gardening, which is connection to the insects, birds, or herbivores, and other living organisms that you interact with when you place your hands in soil?
That is such a great question. For me, when I started this practicum, part of it was doing some work out in the UT Health Holistic Garden, and I started off being absolutely terrified of bugs. But I think that that is a really great aspect. It's not something I spoke about in any of the interviews, but I think that it can be a great way to kind of get over your fear of bugs. Most of the time, they just want to leave you alone. But I do think that that can be kind of a great place to have like interactions with animals. Well, actually, there is one person who spoke with me a bit about animals, but she was telling me about how the garden has to put up fences to keep rabbits out of the fruits and vegetables. So I think that we sometimes think of animals as a bit of a nuisance, or maybe you have a fear kind of animals or insects, but most of the time they want to leave you alone. There are also like organic ways to get rid of things like stink bugs that I learned about this summer. But yeah, it can be a great way to kind of connect with the animal side of nature. And conversely, as far as like the rabbits, protecting your produce from any kind of hungry animals.
Okay, do you have research related to outcomes for school, including daycares, maybe preschool gardens, and examples of schools that have implemented these gardens?
Yeah, that's a great question. I did speak with some people who work at like elementary schools and also one group that works with preschools. I don't have specific names right now of schools, but I'm sure that I could get some. So there are places in Houston that are preschools and schools that are implementing some like garden type interventions and having positive outcomes. But I did not get specific names. I was trying to make sure that data were kind of as de-identified as possible with this work. But there are places that are doing that. I could probably find the names if you want to email me. But yeah, that is something that's going on here in Houston.
And similar to that, What about gardens in senior centers or retirement homes, maybe mental health facilities?
Yeah, okay, so there were a couple of research papers that I read that focused kind of on elderly folks. There was one on anxiety and depression symptoms, and there was another one. There are a couple of different papers about gardening interventions in like homes for kind of like elderly folks who are suffering from dementia. And the dementia case, I think, is really interesting because people had you can have just a regular garden with no kind of special add-ons in it. And for, dementia patients who spend time in these gardens, they do have positive effects on cognition, kind of clarity of mind, lowered fall risk, and just general physical health improvements. As well as mental health. And then for dementia patients specifically, for gardens that have kind of enrichment things in them. So enriched gardens can have things like exercise machines or maybe kind of stations and plaques that advise you maybe like to meditate in this corner or a certain exercise to do in this corner of the garden. But these enriched gardens are even more beneficial for dementia patients. And this was a study where the gardens were kind of placed, these different types of gardens were placed into a home for folks who had dementia. But yeah, there is like some good research on there on positive effects of gardening on kind of the elderly, old folks, and on mental health patients, people who are suffering from dementia. They can still be involved, and there are these positive effects.
Okay, I think we have time for a couple more. So someone's wondering if you could say more about the role that community gardens can play in mitigating the adverse health impact of food deserts.
Yeah, I can definitely say more about that. So again, food deserts are places where there are kind of a lot of high barriers to being able to access both enough food and enough nutritious, healthy food like fruits and vegetables. And community gardens can play a huge role in that. It actually is sometimes a bit controversial in the research because while the effects of community gardening on food insecurity, on increasing food security, are positive, it's not unfortunately like a massively large effect. So I don't think there's any study out there that proves that community gardening cures food insecurity. It's more that it kind of helps increase food security in like food deserts and kind of lower resourced communities. And that's, again, it's a place where people can come and either get sometimes for free or sometimes cheaply these fruits and vegetables that they're helping to grow themselves. And that can be just a really great addition to your diet, to increasing your nutrition. So yeah, there are definitely ways that community gardens and community gardening can really help mitigate, although it doesn't solve yet the effects of living in a food desert.
And then do you have any suggestions for key partners in starting a community garden?
Yeah, so if you're in Houston, there are a couple different places that kind of can help you to start a community garden. Off the top of my head, one place, I believe Urban Harvest has a program. They have a huge farmers market, but they've also got kind of a garden education department, and they kind of partner with people to help start community gardens and get them, affiliated. And then once your garden is affiliated with kind of a wider network, you can have access to things like farmers markets and just other community opportunities. A lot of gardens, again, are a part of a school or a part of a church. Actually, there are a ton of gardens in Houston that are affiliated with a church. So kind of just anywhere you can think of that could be a community center. If they're open to kind of starting a garden, that can be a really, really great place to start looking. I would say that any like linking together people in the community and using kind of community centers for multiple purposes, that I would say is a great way to kind of start with a community garden.
Thank you. And lastly, we have someone from California, and so they're interested in knowing if you interviewed anyone mentioning the sustainability momentum of community members and community gardens. Obviously, there's a lot of passion when it comes to these members. So, anyone mention that?
Yeah. So as far as I guess one, if you're talking about like the environmental side of sustainability, and two, if you're talking about sustaining community involvement. As far as environmental sustainability, a lot of these farms, again, take this agricultural education piece, and there are certain ways that you're supposed to rotate crops out. Like if you plant one kind of vegetable, you're supposed to plant a different kind the next time, just to kind of keep the nutrient balance in the soil kind of positively renewing and replenishing itself with as you go through the year and as you plant different vegetables in the same plot. So yeah, environmental sustainability is huge for these community gardens and farms. Pretty much everyone I talked to spoke about that. And then as far as sustaining community interest and community involvement, that was also another really interesting point that a lot of people brought up. And it comes down to, I think, having a visible presence in the community, and that's both just in person and also online. It's really, really helpful if your garden or farm has a website, especially if that website has an easy to access volunteer page or a page that talks about whatever community event you might be putting on. So yeah, visibility is super important to keeping sustained involvement. But the most important thing is to actually invest in your community, to be there for, I guess, the right reasons. And some of the people I spoke to were really, really passionate about this, that when you invest into your community, they'll invest back into you through their time, through possibly donations. So it's really, really important to get to know the people in the community, get to know what they need, what they want out of these community gardens. And be able to have things like volunteer days or other community events where people can get involved kind of regularly. So yeah, sustained community involvement, super important. A lot of great ways to go about that.
Great, thank you. So that's all the time we have today, and I want to thank everyone for attending today's webinar. The recording, slides, and resources mentioned will be posted on our site. We appreciate you being here, and we will see you for our next webinar on Thursday, August 22nd, which will focus on using food as medicine. Thank you.
Thank you.